A major Madison Health Clinic telling thousands of its patients today they are at risk for blood-borne diseases.
The risk comes after a former Dean Clinic employee used diabetes testing equipment improperly. News 3's Theo Keith is looking into the reason for the notifications. Theo.
Well, the notifications, Susan, come after a former nurse's actions may have exposed patients to hepatitis B, C, and HIV. Dean Clinic officials saying it happened over a 5-year period, adding they just found out this month. Now they're scrambling to tell patients about the risk. Officials say it began here at the Dean Clinic on Madison's east side. The nurse was supposed to show patients how to use insulin pens. She wasn't supposed to use them on more than one patient, but she did from 2006 until August 10th of this year. That was when another employee saw what she was doing and told officials.
We're casting the net very wide in terms of contacting patients. So this morning we began contacting every individual patient that this employee saw during her 5 years of employment at Dean Clinic. More than 2,300 patients at all clinics. Letters and phone calls going out Monday. The nurse no longer with the company.
While this is a serious matter, I don't believe there was anything malicious.
So why didn't anyone find the problem for 5 years? Officials say the nurse was trained, the technique basic, but that it may have to start checking up on nurses more often because of this.
This upsets us all, because this is not what Dean Clinic is about. I want to apologize for the concern that this causes patients and their families, and we're going to do whatever it takes to take good care of these patients.
And that includes paying for the tests these patients may need. We should note, as we did in there, that they don't think these actions were malicious. She did not reuse the needles, but the risk remains.
But Theo, it doesn't appear that all 2,300 people involved will have to be tested, right?
Well, yeah, exactly. The officials say that this is a worst case scenario, that they don't think the nurse poked all 2,300 people, but they're looking to follow up with all of them to make sure.
All right, Theo, thank you very much.